A little more than 20 years ago, Melinda and I read an article about how hundreds of thousands of kids in sub-Saharan Africa and India were dying of completely preventable diseases. So we saw that public health, particularly to get new vaccines out to kids in poor countries, that could be our focus. Now, 2 decades after that early work, we're experiencing a terrible pandemic, an infectious disease that's not just in the developing countries, that's in the entire world. Our foundation, because of our deep expertise in vaccines and infectious disease, has been proud to partner with many others in the fight and the goal of getting out tools to stop this infection as quickly as we can. We've benefited from over 20 years of experience and partnerships, both with governments and with private companies. The world will have many effective vaccines that we can start to scale up and get out to the people who need it most. But, we're not done. We need to continue to invest in R&D, not only to finish this epidemic, but also to be ready for future epidemics. For these innovations to make their full impact, we have to really think through the level of cooperation and planning that's really quite unique. We're going to need a global supply chain and a plan to get out to everyone with the right priorities, starting with the public health workers. Philanthropies like ours have a role to play, and we're going to use our relationships and resources to make sure that we accelerate the end of the pandemic.